Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about using intravenous ozone therapy to help suppress overactive immune system function. I've had many patients over the years with different autoimmune conditions, whether it's rheumatoid arthritis, psoriatic arthritis, Sjogren's syndrome, multiple sclerosis, psoriasis, ankylosing spondylitis, a number of different autoimmune conditions. And what I have found is that intravenous ozone therapy, also known as major autochemotherapy, is one of the most effective tools to help quell that overactivity of the immune system. Obviously, the big problem with autoimmunity is that the immune system is attacking itself, or rather, the immune system is, well, some types of autoimmunity, the immune system is attacking itself, but with autoimmunity, the immune system is attacking healthy parts of the body, and that's obviously not a good thing. So that part of the immune system that's doing that needs to be dampened down. And there's been so much research over the years showing that ozone therapy is capable of doing that. Now, the thing that's important to note with intravenous ozone therapy is that it does take time to work. Granted, there are cases and examples where, one treatment makes, the heavens open up and, the inflammation is quelled beautifully and it's just remarkably effective. But more often than not, we need to do several treatments to really start seeing the full potential benefits of that ozone therapy. And by several, I mean usually in the realm of like 3 to 5 treatments, give or take, usually done, usually a week apart, sometimes, a little bit less than a week apart. So it's not that ozone is, in the context of using it to help quell autoimmunity, it's not like a magic bullet type thing, but giving it enough time to start to work, it can be really, really helpful, and it can succeed where other treatments fail. The other interesting thing to note about intravenous ozone therapy in the context of using it for autoimmunity is that once we get enough momentum with it, then typically we can get away with backing off on the frequency of treatments to still keep the momentum going from those initial treatments. So where we may need to treat, say, weekly for the first 6 weeks or something like that, maybe 8 weeks, then as we're seeing the benefits and we start spacing things out more and see, oh, we're going 2 weeks between treatments, 3 weeks between treatments, and in many cases patients can start coming in for a booster treatment maybe every 1 to 2 months and still maintain those same benefits. Now, of course, we're, for the most part, in most cases, trying to figure out, well, why is that autoimmunity being triggered in the first place? What's driving the intensity of those symptoms? So we're looking for root cause factors, we're detoxifying, we're immunomodulating through other means, etc. So hopefully the intravenous ozone is just a sort of an interim measure to help quell things, knock the symptoms down, and then eventually is not needed at all. We strive to do that with all patients. Some cases are more difficult than others, and of course some patients don't want that. They're happy with the ozone working and they just stick with that, and that's their business and that's fine. But as best we can, we try to get to the point where the ozone is not required in any way, shape, or form. So take-home message is that the intravenous ozone therapy can be really helpful when it comes to different autoimmune cases, and while we certainly don't need to use intravenous ozone for every autoimmune case, it can be a really, really effective tool. So I hope this information is helpful. If you have any questions about this topic or anything else, just post it in the comment section below and I'll answer that question as soon as I'm able to, and I will leave it there for now.